In the last 7 months, 8 months, I've attended most of the Mount Diablo Health Care District meetings. I think I've probably been, in many cases, the only Concord actual representative citizen in the audience. They've been rather interesting meetings. As I understand it, the proposal here is to provide some response to LAFCO in regard to the possibility of dissolution. I don't want to get into a debate on whether it should be dissolved or not. My opinions are known in that. There is two aspects that we need to be reminded of. One is the monetary aspect. Not only is there a flow of $200 and some thousand going into this district from tax money, and another $25,000 from the John Muir directly to pay for administration and issues. But often neglected in the discussions is the fact that they're sitting on $700,000 to $800,000 additional monies that hasn't been spent. This is monies that should have been spent on the community, and for whatever number of reasons, which we won't get into, wasn't. So this is a major distraction, and it's a major economic and political fight. But there's another aspect that is equally important, and that is that hospital that's over here. And the fact that what happens to that hospital in regard to the original documentation. That hospital is tied into the livelihood of this community and into the quality of life. I have stood in that emergency room and seen Mr. Helix come by. I've stood in that emergency room with a 6-year-old kid that we were rushing from a school accident. Now, 30 years from now, 40 years from now, this agreement comes up with John Muir. This is our only shot. If this is dissolved, this is our only shot to control what happens back then. Now, even though when it comes to money to be spent in our community, I do not like to slow down to light speed, to jump on it. It's for our community. I also have to be very cautious on terms of the legal ramifications of the operations and the future of that hospital. And I, who don't like to slow down, have to advise the council that we need to go cautious on that aspect and not be distracted by the money. I know it's hard. You know, it's like, let's jump on this.
Eddie, we're not making a decision tonight, though.
Right, but we are making a recommendation to NAFCO. And therefore, we need to study this. We need time. And I don't think that the 2 weeks between now and December 27th, we will be able to ascertain all the complexities, as well as to bring in the community. And therefore, I would recommend that, number one, that we tell LAFCO tonight, because they have a meeting tomorrow, that they're not giving us enough time, that they need to postpone the decision on this, because the city of Concord, the people of Concord, can't get to you in 2 weeks' time to unravel all the things, and the important part is what happens down the road. Because we only got, if they dissolve this district, we're only going to get this one shot at how to structure that our grandkids are going to have to deal with. And I don't want to,
You have to wrap it up, please.
Okay. The other second idea is that if this is to be dissolved, the 5 positions that are appointed to the Charity Health Foundation, I would like to see reserved 3 for Concord, 1 for Martinez, and 1 for Pleasant Hill, because there's $1 million a year that comes out of that foundation. And this way, if we have 3 from us, 1 from the other cities, we can at least be able to preserve a voice in that fund, which is the other thing that the district provides. So those are the 2 aspects. One, we need to tell them right now that they're not giving us enough time, and it's not fair to the city of Concord. And second, if they do dissolve, and my view on it being dissolved has always been that there needs to be a separate district, but If it is to be dissolved, we want 3 of the 5 positions reserved on that board so that we can get our right share, our fair share, because it's our community that's served for the most part.
Okay.
Thank you.
Thank you, Eddie.